Hello, I'm Dr. Fredrick Echols, Acting Director of Health for the City of St. Louis. This week, 3 of the 4 questions submitted to the Department of Health focused on immunizations and vaccinations. Gary from zip code 63103 asks, what's the purpose of vaccines and what do they do? To understand how vaccines work, it helps to first look at how the body fights illness. When germs such as bacteria or viruses enter the body, they attack and multiply. This invasion, called an infection, is what causes illness. Vaccines greatly reduce the risk of infection by working with the body's natural defenses to safely develop immunity to disease. Vaccination, treatment with a vaccine to produce immunity against diseases, protects individuals from illness and complications of vaccine-preventable diseases, which can include paralysis, hearing loss, nerve damage, brain damage, and death. It is important because it not only protects the person who gets the vaccine, but also helps to keep diseases from spreading to others, like family members, neighbors, classmates, and other members of our communities. When a high percentage of the community is vaccinated, it creates herd immunity, which reduces the likelihood that diseases will spread within a community even if one person is infected. Brian from zip code 63147 asks, what are some of the illnesses that put individuals at higher risk and in greater need of a vaccination? Vaccination is a critical step in protecting those who are most vulnerable to illness. Infants, young children, the elderly, and those with weakened immune systems and chronic conditions such as diabetes, cancer, heart and chronic liver disease, and chronic lung diseases. Mattie from zip code 63115 asks, I'm considering taking a food service job to supplement my income during the pandemic. I was told I need to get a hepatitis shot. Knowing that the coronavirus vaccine may be available soon, should I be concerned about getting other vaccinations like a hepatitis shot? Routine vaccination is an essential preventive care service for children, adolescents, and adults that should not be delayed because of the COVID-19 pandemic. Starla from Murrieta, California asks, I'm contemplating visiting a friend in Belleville and will be traveling to the St. Louis airport. Besides face masks, hand sanitizer, and limiting my contact with people during my stay, are there other concerns that will keep me from visiting? Although the St. Louis airport and the St. Louis metropolitan area do not have travel restrictions, the City of St. Louis Department of Health joins the Centers for Disease Control and Prevention in recommending postponing any unnecessary travel. Travel increases your chances of getting and spreading COVID-19 and other communicable diseases. Remember, don't travel if you're sick, and don't travel with someone who is sick, or if you have been around someone with COVID-19 in the past 14 days. Thank you for tuning in this week, and thank you to everyone who sent questions. Be sure to tune in next week for more critical public health information. I want to hear from you, St. Louis. Please send your questions to health@stlouis-mo.gov. Questions will be answered in the order they are received. If I run out of time on air, your question will be answered by return email. Be well.